My name is Maya Alfin. Today I'm here to propose a new form of therapy. But first, let's talk about PTSD. What is PTSD? PTSD is a shorthand for post-traumatic stress disorder and can be defined as an anxiety disorder caused by traumatic events that affects a person enough to have negative impacts on their day-to-day life and functioning. It can occur at any age and is directly associated with exposure to trauma. Though commonly known for occurring after one goes to war, previously known as shell shock, numerous other events can be traumatic enough to cause a person to develop this disorder. For example, an accident, sexual or physical assault, natural disaster, severe or persistent bullying, and even being a witness to a violent act. Symptoms to PTSD include re-experiencing type symptoms, such as recurring, involuntary, and intrusive distressing memories, which can include flashbacks of the trauma, bad dreams, and intrusive thoughts. Avoidance, meaning a person actively stays away from certain places or objects that may remind them of the traumatic event or trigger overwhelming symptoms. Cognitive and mood symptoms, including trouble recalling the event, having a negative self-worth, feeling numb, guilty, worried, and depressed, and even having out-of-body experiences or feeling as though the world is not real, derealization. And lastly, arousal symptoms, such as hypervigilance, which is when a person is consciously or even unconsciously always scanning the world for danger as their senses are heightened. Unfortunately, it is estimated that roughly 9 million American adults are affected by PTSD. Of those 9 million people, an estimated 37% are classified as having severe symptoms. That's a whopping 3,330,000 people. These are the people I want to help. Currently, those with severe PTSD only have a few options. With the psychotherapy approach, one can undergo cognitive behavioral therapy, which is working to retrain a person's thoughts. There is also EMDR, or eye movement desensitization and reprocessing. One may also be prescribed medications, such as SSRIs, which give a person the brain chemicals they need in order to feel homeostasis, or benzodiazepines, which work to calm or sedate a person by raising their level of GABA in the brain. Recently, psychedelics have been introduced into the world of trauma treatment. Ketamine, specifically, was just FDA approved for this very purpose. The process for this to happen, though, was a long one. In the late 1990s, the National Institute of Mental Health began exploring the antidepressant potentials of ketamine as an alternative to SSRIs. Their effort, however, was focused on eliminating the psychedelic effects of the drug while retaining its antidepressant properties. Throughout their experiments, some degree of mind alteration would occur despite their efforts against it. It was then seen by some of the researchers that there was enhanced benefit from the presence of psychedelic experiences. These findings were similar to those in psilocybin studies and suggest that profound psychedelic experiences may improve one's mental health and overall well-being. The psychiatric establishment, however, tended to avoid that understanding and instead kept trying to find a way to use ketamine's antidepressant effects, calling the psychedelic effects undesirable side effects. Many others saw it differently, though, and have developed and practiced today what is now known as ketamine-assisted psychotherapy for the treatment of emotional suffering, such as treatment-resistant depression and PTSD. Its proven safety over decades of use make it ideal for office and even supervised at-home use. So what else can be done? What else can we do? I think we should be researching more ways in which psychotherapy can be combined with other treatments and other psychedelics. Why stop there? Why stop with ketamine? I propose ayahuasca. Ayahuasca is a strong psychedelic brew that has been used by the indigenous peoples of the Amazon, Mestizo shamans, and those of the Brazilian churches for centuries, possibly millennia. It has been used for both spiritual and religious reasons. Made from two plants, Psychotria viridis, or the ayahuasca vine, and the Banisteriopsis caapi, or chacruna leaves, it can alter all one's senses and even consciousness, causing a person to experience hallucinations and even out-of-body experiences. Over the past several decades, there has been a growing interest in its possible therapeutic effects at an international level. Many different groups of peoples have harnessed the healing powers of ayahuasca, and so there are many different ways in which it has been used. Healing-wise, ayahuasca aided in the identification of illness origin, shamanic journeys to restore soul loss, extraction of pathogenic objects, and shamanic fights with the animated agents of illness. There is one thing, however, that is seen as the underlying principle that is understood through all practices, and that is the notion of cleanliness. It is believed that ayahuasca and its potent psychedelic properties have the therapeutic potential to help aid in the treatment of depression, PTSD, and other psychiatric disorders. I propose that we do more extensive research on ayahuasca and psychedelic-assisted therapy. As of now, the U.S. Supreme Court has sanctioned the use of ayahuasca only for spiritual and religious practices. The FDA classifies ayahuasca, rather its main component DMT, as a Schedule I substance, meaning there is a lack of any accepted medical use or safety data, and there is also potential for abuse. That being said, ayahuasca does not appear to be addictive, nor does it have any adverse effects, at least when a guide is involved. Research teams have done multiple studies on its effects with depression, which have shown replicated positive findings, but the results must be viewed as preliminary, and so the data we have currently is insufficient to support the use of ayahuasca in a clinical setting. So what can we do about that? Well, we can first find an exact recipe for the psychedelic brew, consistent ingredients and ratios that work the best for treatment. This is because currently there is a lack of chemical analysis that confirms the exact ingredients in the ayahuasca drink used in the studies. This is due to numerous other ingredients that have been described across indigenous preparations, such as caffeine, nicotine, cocaine, and scopolamine, among others. Also, randomized clinical trials using pharmacologically pure compounds are necessary to advance our knowledge about the therapeutic potential of ayahuasca. As I said earlier, current results must be viewed as preliminary due to there not being any randomized, double placebo, or placebo-controlled studies done yet. Ensuring that these steps be taken will boost the conversations on ayahuasca-assisted psychotherapy. Of course, there are many things that could get in the way or slow down progress. For one, the war on drugs. People have been against psychedelics forever, or more accurately, the 60s. In 1965, there was a federal ban on the production of all psychedelics. Unfortunately, that included the production of these drugs by companies using them for research. Some say that this is simply due to psychedelics being introduced to the general public too quickly, causing panic. Illing from Vox says that the population had no experience with them, no sense of their significance, and many agree. If we were to bring back psychedelics, all we would have to do is make sure the drug panic that happened in the 60s doesn't happen again. To do this, we simply need to regulate the drugs and inform the people. Psychedelics have too much healing potential to be kept in the dark. If they are federally regulated, then that would ensure that the drugs are made to code and are safe for consumption. It would also ensure that the drugs are only to be used in regulated settings, such as for spiritual or religious ceremonies or for psychotherapy. Of course, even with all the regulations set in place, people will still find ways to get their hands on them and do illegally. Rather than making them illegal overall, which would only take away from those who could benefit from them, we need to inform the public. The general population needs to be made aware of the great potentials of taking psychedelics and the risk of taking them without a guide. In this way, psychedelics may even help more people than anticipated. In the end, I'm envisioning a future where psychedelic-assisted therapy is accessible for anyone and everyone who may need it. Whether the psychedelic be ketamine, MDMA, or my personal favorite ayahuasca, we can already see so much therapeutic potential within them. I propose that we continue research on psychedelics, specifically ayahuasca, in order to get to this healthy future.